Imagine this. A country gives nearly 90% of its people universal health coverage. You'd think, okay, great, people are financially protected, right? Families shouldn't face poverty just because they needed a doctor or, a prescription. But our deep dive today into Georgia's healthcare system, well, it reveals a bit of a surprising twist to that promise. We're looking at a new study from BMJ Global Health. It's called Financial Protection and Universal Health Coverage in Georgia. And our mission really is to unpack why. Why, despite this big universal health coverage program, the UHCP, since 2013, are so many Georgian households still facing serious financial hardship for medical costs? We want to pinpoint the unexpected culprit and see what lessons we can learn for health equity everywhere.
It is a fascinating paradox.
Yeah.
Georgia's UHCP has been around for over a decade, covering most people. Yet, the study found the number pushed into poverty by health spending. It stayed stubbornly high, comparable to other European countries, and it hasn't really budged much in 10 years. It just goes to show, doesn't it? Simply expanding service coverage, well, it doesn't automatically mean better financial protection for everyone.
Yeah, that's quite sobering after a decade of effort. So what's stopping that financial protection? I mean, with such wide coverage, we thought going into this, maybe it's hospital stays, complex surgeries, driving costs. But the data, it actually showed something else entirely, a real financial weak spot for families in Georgia. It's the out-of-pocket spending on drugs.
That's right. The study flags this as the single biggest factor pushing families into poverty. The odds ratio they found is, it's alarming, 43.3.
43.3. Wow. Can you put that into perspective for us?
Sure. It essentially means the odds of a household in Georgia falling into poverty because of what they spend on medicines are over 43 times higher than because of other health costs.
Yeah.
It's just a staggering figure. And, it hits the poorest 20% the hardest. For them, the odds are even higher, 44.5 times, specifically because of those drug costs.
But it's not all bad news, is it? The UHCP did achieve some things.
Oh, absolutely. It's a real contrast when you look at inpatient care, like hospital stays. The program has largely succeeded there. By 2023, the government was funding about 81% of inpatient services, and that led to a really significant drop in the odds of impoverishment from hospital treatments. So the program can protect, definitely, in certain areas.
Right. So it works for hospital bills, largely. But drugs are this major leak in the financial safety net.
Exactly. And speaking of how policies work, the analysis also showed something really interesting about policy shifts over time. If you look back, between 2009 and 2013, government benefits were more targeted towards the poor. And during that period, the odds of impoverishment actually hit their lowest point in 2013. The odds ratio was just 0.28, so much lower risk.
Okay, so targeted help seemed to protect the poorest better back then.
It seems that way, because after 2013, when they switched to the broader less targeted universal program, the UHCP, those odds actually crept back up slightly. They averaged about 0.34 between 2014 and 2023.
So moving to a universal system, maybe without enough focus on, say, drug costs for everyone, might have inadvertently left the most vulnerable kind of exposed.
It suggests that, while universal coverage is the goal, the design really matters. A broad approach might spread resources a bit too thin, especially for things like drug subsidies, which are critical for the poor. The earlier targeted approach maybe did a better job of hitting that specific crippling cost for those families. And it's not just drug costs, though they're paramount. The study also mentions other factors, moderate risks, things like being in a female-headed household, lacking higher education, or having very young kids or elderly members or people with disabilities or chronic conditions. These all add to the vulnerability.
Okay, so it's complex. Given all this, what's the path forward for Georgia and maybe for other countries watching?
Well, the study points towards something called progressive universalism. The idea is to expand state funding for pharmaceuticals, yes, but start by specifically targeting the poorest 20%. Really focus the subsidies there first. And the good news is Georgia apparently already has the administrative systems to identify these groups accurately. So it's seen as a feasible, potentially high-impact policy. It could stop nearly half of those vulnerable households from falling deeper into poverty just because they need medicine.
So it's not abandoning universalism, but making it progressive, focusing help where it's most desperately needed first as a foundation.
Precisely. It's about building that safety net strategically before maybe broadening out certain benefits later.
Right. So wrapping up, we've seen how Georgia's UHC journey, while definitely having successes like with inpatient care, shows a critical vulnerability. It's those out-of-pocket drug costs really hitting families hard. And that contrast between targeted and broader universal benefits, that offers some really crucial lessons.
Yeah, absolutely. And for you listening, as countries everywhere push for universal health coverage, this really reminds us that just, spending more public money or ticking the coverage expanded box isn't the whole story. True financial protection, real equity, it seems to demand a much closer look at the local situation. Prioritizing specific benefits, like maybe medicines, and smartly targeting support to those who need it most. Because let's face it, trade-offs in healthcare are pretty much inevitable. Making smart, context-specific choices seems absolutely key. Makes you wonder, doesn't it? What specific part of your own country's health system might be that unexpected financial weak spot for its most vulnerable people?